Hello everyone, I am Dr. Mohana Preethi and I am a cornea and a phacosurgeon. Today we will be discussing about dry eye syndrome. So coming to dry eye syndrome, what is actually dry eyes? We all have a tear film in our eyes which helps to attain moisture to the cornea and helps in protecting the cornea from harmful substances from outside. So whenever this tear film is reduced or when tear film is totally lost, what happens is we have a gritty or a sandy sensation in our eyes. So this mostly occurs especially in software work, software professionals or in people who are using the screens for a lot of time because they will be looking at the screen for such a time with staring looks. So this helps in evaporation of the tear film and causes this dry eye syndrome. The main cause for dry eye is computer eye syndrome, that is increased usage of screens. Last 2-3 years, there's an increased usage of phones even in children because of online classes, increased usage of mobiles even with household women and everyone, along with software professionals who have increased their work from home. So especially computer dry eye syndrome is a main reason. Apart from this, any infections in the eye, any allergies can cause a dry eye. This is more common these days because of the online classes that have been prevalent in the last 2-3 years with the rise of COVID. Also increased work from home for software professionals and as well as increased usage of screens, mostly usage of Netflix and all in the TV and as well as phones. Once we are attained to the increased usage of screens, we have a gritty sensation. Since all the moisture is lost, we feel like something is there in the eye. We always tend to rub our eyes. There's a gritty and a sandy sensation, like there is an object inside the eye, but actually there won't be any object. It is because of the sandy sensation that we usually feel. Also, we'll have a lot of itching and a little bit of pus formation. As soon as we get up in the morning, we feel like rubbing our eyes and there will be pus formation. We tend to rub our eyes so often that it increases and changes our glass power also sometimes. Once we are rubbing our eyes, what happens is whatever dust or infections is in our fingers and in our nails, it usually enters our eye. It results in increased infections. Also, because the cornea is totally dry without any moisture, just like how if we are not watering our plants and there are usually cracks in the soil, the same thing happens when the moisture is lost over the cornea. So it leads to recurrent infections, recurrent conjunctivitis, and also there will be usually redness of the eyes. The people, when you see software professionals, sometimes they might be having to do night shifts or work at nights. So with the increased screen usage at night times, they'll be having that eye redness, constant eye redness that doesn't decrease, as well as itching. There are also ointments and eye drops where electrolytes are incorporated, where vitamin A and vitamin B12 is also incorporated. So according to the severity of your dry eye, your eye doctor might prescribe what is suitable for you. Also, the frequency of installation of eye drops is important. So a minimum of 4 to 6 times installation is important. Usually, when you are prescribing 4 to 6 times, patients have a tendency to use only 2 to 3 times or only once in a day or once at night time. So this must be avoided. Try to use the eye drops as many times as possible as prescribed. And if necessary, an ointment might be prescribed, which should also be used. Usually, dry eye doesn't go on its own, especially when you're on the screens for long run. It doesn't go on its own. You might have to use artificial tear substitutes for that. So there are a lot of artificial tear substitutes in the market. But apart from this, we should also change some lifestyle measures. And we should also incorporate some measures like increased blinking. And every 20 minutes, we need to take sufficient 2 minutes break, either by looking at the wall or something, an object 20 feet away. This is called the 20-20-20 rule. So every 20 minutes, at least for 20 seconds, minimum 20 seconds to 2 minutes, just close your eyes or look at an object far away. So an adequate break of 3 to 4 minutes every 1 hour is essential to prevent dry eye. Also, drinking a lot of water is important and avoid staring at the screens. Try to blink as many times as possible, every 1 to 2 seconds. Along with changes these lifestyle measures, you also need to instill the eye drops according to the eye doctor prescription. Prevention of dry eyes is mainly by increased blinking every 1 to 2 seconds. Make it a habit to blink every 1 to 2 seconds. We forget blinking while we are using the screens. We tend to look at the movie or we tend to work just by staring at the system, which we should totally avoid. Try incorporating blinking as many times as possible and try the 20-20-20 rule. 20 minutes, 20 seconds break, 20 feet away object, you have to look. So this 20-20-20 rule has to be incorporated. Water hydration has to be increased. Avoid rubbing your eyes, and if necessary, if there's a lot of itching and you still want to rub your eyes, you can apply ice packs or gel packs over your eyes, which gives you a lot of comfort. Try to reduce the brightness of your screens and try to not use phones during your night time. Especially, you have a tendency to use phones for long hours during night times. In such dim lights, try to reduce the brightness if you are looking at it. And as much as possible, try to avoid looking at the phone during nights. Even when you are looking at the screens, mostly try to make it a habit to blink and take adequate breaks. If not necessary, try to avoid the screens for a lot of time. If there is no work on the laptop, please don't look at it because your eye health is important and your corneas, especially with software professionals, since they are working for such long years, they'll have a tendency of getting infections in the long run. So you must make sure or assure yourself that you are not impending your eyes to such extent.